This is really where the rubber meets the road. You got a breach, you got to notify somebody. Who do you notify? When do you have to notify them? And what's involved? Who has to pay for the notification? And you have to stop and think about, are you a covered entity or are you a business associate? If you're a covered entity, you have certain notification requirements that are a little bit different from if you're a business associate. Let's talk about our obligations to make notification. There's a big bright line that's drawn in the rule, and that is 500 folks. We got 500 records. If there's less than 500 records have been breached or unauthorized access, then we have one level of notification. If, on the other hand, more than 500 records were breached at any one particular time in one event, then we have a separate set of obligations. So let's talk first about what happens if you come across a breach and it's less than 500 and the records are wrapped up into this one particular breach event. What do you have to do? Well, if you have less than 500 individuals, then if you're a covered entity, you have an obligation to notify by U.S. mail that their data was breached. These are going notifications directly to the individual themselves. You've got to notify the individual, or if the individual is deceased, the next of kin of the individual. How do you make notification? You make notification by first-class mail, or if the patient gives you permission, by email, and that's at the last known address. And if you don't have sufficient, or if your information, or if you have out-of-date contact information, then there is a conspicuous posting permitted on the homepage of the website of the covered entity, or you can do notice elsewhere in the media if you want. So you've got an obligation to actually notify. To actually notify the individuals, and stop and think about that for a moment. You need to notify them by their most recent address, and you have to do it by first-class mail. And think about the cost of doing a first-class mail if you've got a lot of people involved. What happens if we have a breach? And by the way, when we have less than 500 people, you do not have an obligation to notify the media, and you don't have an obligation to notify the Secretary of Health and Human Services immediately, but you have to make a log of all the breach notifications, breach events that you've had, and who was involved, and what you did to fix it, etc. And you need to get that information to the Secretary at least once a year if you have events that are less than 500 individuals. If you have more than 500 records were compromised, then you have a different set of obligations. Again, you need to go ahead and make notification to the patient, to the individuals that were affected by mail or email if they permit. But you also have to you also must make notification to the local media if there have been more than 500 records or persons involved in a single jurisdiction. And that's kind of a strange idea. What does it mean to be in a single jurisdiction? I mean, what happens if you're in Northern Virginia and you've got some folks in Maryland and D.C.? The rule kind of breaks it out and says, well, if you don't have more than 500 individuals in a single jurisdiction, you don't really have an obligation to go to the local media. If you have 502 in one jurisdiction and 480 in another jurisdiction, it's okay to go just to the jurisdiction, the newspaper, or it says use prominent media in that jurisdiction, whether that's newspaper, television, or radio is kind of unclear, but we use one of those prominent media outlets. You can use the prominent media outlet for the location where there were 500 folks or 508 folks, but not necessarily the one that were 480. But regardless of where these people live, you do have an immediate obligation to notify the Secretary of Health and Human Services of the breach, how it happened, what steps you took to, find out, and what steps you're going to be taking to mitigate. So you kind of have this threshold where if you've got a less than 500, you have certain obligations regarding to the Secretary of the Media. If you have more than 500 records, then you have a different set of obligations. And I can read, let's think about it for a minute about timing. What's your timing here? The obligation to notify the patient has to be prompt, but not later than 60 days from the discovery of the breach. When does the clock start? What is the discovery of breach? Well, the discovery of breach is the date you actually knew about it, or you should have known about it, depending on all the facts and circumstances coming to your attention. What about if you're a business associate? Well, if you're a business associate, you have an obligation to go ahead and to tell the covered entity, and whether or not you have to then bear the cost of notifying patients or others. Basically, is a contractual obligation that you, as a business associate, have negotiated with your covered entity. Remember that I said that you have an obligation to report to the Secretary of Health and Human Services. If it's more than 500, you should do that immediately, which kind of means the exact same time you tell the media and the others. And if you have less than 500, then you must notify the Secretary of Health and Human Services by 60 days, before the end of 60 days of the end of the year, for all the less than 500 events that you had. And you can go to the HIPAA website, Secretary's website, and actually see all of the reportings of breaches that have been made, and it's kind of fascinating. Through 2009, when these first started, there's been 1,547 different breach notification reports that have been made to the Secretary, and they make for kind of fun reading. Here's one example. In January of this year, a company called Elite Imaging in Florida, the healthcare provider, reported a theft of protected health information. It was not the theft of a laptop. Rather, it was that login book at the front desk. Somebody stole the login book at the front desk, and it was returned anonymously with a letter. And the login book contained the patient's full names, the name of the procedure for each patient, which was kind of, I guess that's, my name's Mr. Smith, I'm here for an appendectomy. Well, okay, that's a unauthorized access and disclosure of someone's protected health information. The breach affected about 1,500 people, and the covered entity, the healthcare provider, provided notice to the Department of Health and Human Services. They said what happened, who was affected, and the media that was involved, and they also contacted the local press, the newspaper and the radio folks. And so what happened, they didn't get beat up too bad because they did their retraining of their personnel, and they started using shredding services for their login books. But I thought it was kind of fascinating when we stop to think about a breach. Typically involves some electronic thumb drive or some hacker into your database or lost laptop. No, somebody came in and stole the login book, and that was a breach you had to report. So that's kind of what your obligations are. Principally, they are to report, and I'm going to let Jason continue on and tell you a little bit about what's required, what's inside these notices, and what's going to be involved.